The materials and information provided are for informational purposes only and are not intended for use as diagnosis, prevention, or treatment of a health or other problem, or as a substitute for consulting a licensed medical professional. Some concepts presented herein may be theoretical and have little or no scientific substantiation. Users are advised to conduct their own diligence.
Welcome to Ask the Experts, where you'll learn about a variety of life-enhancing subjects. Today, we delve into holistic healing and whole food nutrition with the Natural Health Authority, Jason Eagle of Strategic Healing. And now here's Jason.
Okay, hey, this is Jason Eagle, your Natural Health Authority, with another show today on talking about health, and we're talking about the health of knowledge and the health of understanding, and that's what I give here. Basically, tell you what you should know about your health and what to do about it. And so my name is Jason Eagle. I'm what's called a quantum reflex analysis practitioner. You can go to my website, which is strategichealing.us. You can call the show, or I'm sorry, call the office to schedule appointments, ask questions, buy products, these things, 734-985-5891. Right now I am on Facebook. I have a Facebook Live, and that's Strategic Healing. And then later I also post these, which I'm doing a video of this show, so that you can rewind it and listen to it again and see it again, because you can't rewind radio, but you can rewind YouTube. So I put it on my YouTube channel, Jason Eagle QRA. And today we're going to, first of all, we're going to start off by finishing up some cases that we had from last week. And then we're going to talk about the story of your immune system, because that then fades into later, which is we're also going to have a call from Dr. Sivakumar. Dr. Sivakumar is a doctor here in Michigan that he works, he has a COVID wing. He has been treating people with the coronavirus from the very beginning and still is. And today we're going to talk about antibodies. We're going to talk about the immune system. And then after we have that part, we're going to then get into discussing what does that mean? What did we just discuss? And I hope to kind of explain it to you a little bit more. And then we're going to finish up the show with this. Okay, now that we've discussed these before and after and what we know about it, now hopefully we know a little bit better about what our body is and what our body can do and what we should do with our body, what to do, what should we do to help to acquire immunity. So this is the race towards personal immunity and then what's called herd immunity. This is the whole goal is if we really get back to what we would call the new normal, which was always the same old normal. The new normal is the old normal, which has always been true, which is you have to adapt. You have to take what you are, it is what it is. And the whole point, that's the whole point about your immune system, is you get what you came into life with, you got what you were gifted with, which is essentially like your inheritance. And some people inherit more than others, some even in the same family. Some is the really healthy kid and some is the really weak kid. But that doesn't necessarily mean that the weak kid, let's say you came in sickly, that you couldn't then develop into, let's say, a life that would be even healthier in other respects, and even in the same respects, than the person that was gifted with great, ability. The person who's born the jock, but yet the person who is born the sickly, weak one, who then studies. And, JFK is a good example. Dr. Bob Marshall was a good example, which is they had things wrong with their body at an early age, but because of that, they then adapted, which is they learned, they stayed in and they learned, they developed their brain, they developed their thinking process, they developed their logical process, they developed their communication skills. So a weakness then turned into an actual advantage, and that's what essentially, that's what a development of an immune system is. Forget about what we call immune system. It's just, can you survive? And then beyond that, we don't want to just survive. We want to thrive. And that's what the whole thing about adaptive immunity is It's not just like, oh, great, now I have an antidote for this. It's not only an antidote, it is actually the code to break other things. And so immunity is when it's done right and done correctly, and we are given this ability, that it is you're made stronger by it, and a society is made stronger by it. So do not fear developing immunity. It's a good thing, and that's what we want. So again, my name is Jason Eagle, your natural health authority, and let's get into finishing up with some of these cases that we had that I wanted to talk about. Cases, which is, I remember what I wanted to say. It's that the rest of the story, that's a really good one because a lot of times, you hear like this person had this happen and they got arrested and or whatever, this tragedy happened, and then we never hear, well, and then what? Like, did it all end up right or did they? What happened? So the news, as well as even stories, oftentimes just kind of tell you the tragedy part, but it leaves you hanging and you never find out what happened. Like even in the radio call-in shows about, like, for instance, people calling in and saying, I've got this problem. Here's what you should do. You don't hardly ever hear them call back or the practitioner talk about it and say, you know what, this is what happened. This is where it started. This is where the middle was. And that's what we want to know. I want to know the whole story because that needs to become your story. So this one time I dealt with a woman and she did not have cancer, but she had a high cancer risk in her family. She had a lot of breast, mother I think died from breast cancer, uterine cancer and things like that. So these particular cancers are what's called estrogen dominance, meaning it's as if they have too much estrogen in their body, right? And in fact, back in the day, some of these cancers were actually even induced because we put people on estrogen therapy. So if you went on, let's say, early menopause, or you had a hysterectomy, this is back in 1970s and 80s, and you had very low estrogen. And so in order to manage your symptoms, they would put you on estrogen. Well, they noticed this is the same thing that they're noticing with putting men on testosterone is that it can turn into cancers because too much of this particular so too much of the estrogens can cause the cells, in particular breast tissue and reproductive organ tissue, that would be uterus, that would be testicles, that would be prostate, these types of things. Those specific parts of your body are the factories where these things come from and the things that change when you get these levels up. So what makes a baby inside develop into whether it's going to be male or female is it really has to do with these hormones, the presence of these hormones. And that's why we can see, for instance, men, as they get older and they get unhealthy, certain men will develop man boobs. They literally will develop breast tissue. That's not just fat, but because they have too much estrogens. Now, it's not real estrogens. This is what's called xenoestrogens because in our modern world, you have to understand that this is all a chemistry set. Your body is a chemistry set, and you are living in a soup of chemistry, okay? And hormones would be considered chemistry, okay? So again, if you feed a person either through injections or through food a certain type of hormones, those hormone levels will be elevated. So that's why they've reduced and got rid of most milk that doesn't have human growth hormone because they did put human growth hormone in the cows, but this stuff was spreading through and it was affecting children and adults, okay? Well, we live in a modern society where ever since we started digging stuff out of the ground called oil and producing it into petroleum products and then producing it into plastics, which now we have microplastics. And so we're eating this, breathing this, all this stuff. And, these chemicals are toxic to our body. These products are toxic to our body. Well, God created us so that we have filter systems, which is you can neutralize. You can basically, turn the bomb off, to like the bomb squad that goes in. So everything that's possibly damaging in our body, there are mechanisms, whether it be antioxidants or all kinds of things, that it's a way to diffuse the bomb. There is no bomb, including virus or anything, that has been developed to kill all humans because the body develops and it has all these different types of developments, right? So what happens, though, is that our body we're still kind of living in our ancient bodies, and we are now, because a couple hundred years ago, a person hardly ever saw, most people on the planet ever came in contact with certain parts of these chemicals, especially like the bisphenol A and stuff like that, which is this plastics, okay? What happens is when this stuff goes into your body, this is a toxin. They are toxic to the cells. They are what's called carcinogens. They cause cancer. They cause different anomalies in the body where the body doesn't grow correctly, and it can cause damage in the body. So what the body does is detoxifies these things to get it out of the body. Well, most things, when they're detoxified, it goes from this stage to a detoxified. Basically, most bombs, you only need to, turn it off once. Okay. Well, petroleum products, they have what's called half-lives, which is they break down into a smaller particle and then a smaller particle and a smaller particle. And it takes 5 to 6 times for it to get out of the body, meaning it doesn't just go out of the body, it gets developed into smaller puzzle pieces. Well, the thing is all of these puzzle pieces, actual puzzle pieces, like say zoom into the body with like a microscope and you see what cells look like. You know how they've been showing the coronavirus that they call it a corona because it looks like a crown. It's got these little spiky things. It looks like a pin cushion with pins. That's what it looks like. Okay. So what you look like on the inside is basically these puzzle pieces that are the detoxified part of especially petroleum products is they have the same shape as estrogens. And so what they do is the way that our body works is our cells have these little docking ports on them, which are these little puzzle shapes, which are exactly like that game that you played when you were a little kid, where you had to pound the blocks into the right shape. And if you were like me, you were maybe the kid that was trying to pound the star shape into the triangle one, and I was going to make that thing fit. Bam, bam. It doesn't work. Well, that's how our cells are. Our cells have these receptor sites, these docking points, and they literally fit the puzzle pieces. So what's happening in modern life is literally the cells are being overfilled by these things that look like estrogens, but are not truly estrogens. And so, again, like I use the analogy, if you work at a company and you have your designated parking spot, if someone parks in your space, you can't go to work. You'll just be, driving around the parking lot because that's my space. Get out of my space. Okay? So, with this woman, in particular, people that are dealing with cancer risk, especially the ones that are xenoestrogen, what do is you put something in the body that will suck up these things, that becomes like a magnet to attract it. It's like to get the dust bunnies. You get one of these special cloths and it just sucks them. That's what seaweed does. Bladderwrack and kelp and Irish moss and stuff like this, this is what's called the XenoStat. When you put that in the body, what it does is it sucks up. That's one of the reasons why the Japanese women, even in super toxic, polluted Tokyo, that has just a swimming of plastics and stuff like that, compared to us, they have way lower incidences of breast cancer and even reproductive organ cancers because they consume so much seaweed. They consume so much green tea and seaweed. Seaweed is the thing that really sucks up. And again, we get iodine. Now, it's not iodized salt that's the best thing. Actually, seaweed provides, when things grow in the water, especially in the ocean, this metal, this salt metal called iodine, is made into its structure. So when we take seaweed, that's what our thyroid needs, okay? So, and again, thyroid, if you have an overactive thyroid or underactive thyroid, you can have all of these metabolism problems, including making you prone to certain cancers. So, for instance, the first step that we did is we bring the XenoStat, which these seaweeds, you take them in like a capsule form, and most people it's like around 6 to 12 of them a day. Seems like a lot, but they're not. It's not that big of a deal. Okay. Then the other thing that she for sure had what's called polycystic ovarian syndrome. She had cyst on her ovary, which that also, why did these things grow? They grow there because if you have too much estrogen in your body, see, when a person gets pregnant, that's what happens. When a woman gets pregnant, the estrogen levels go up, and when estrogen levels go up, that then triggers the body to develop certain things and grow certain parts of your body in super mode. So it will grow breast tissue. That's why a woman's breasts grow when she gets pregnant. It's also why a man's breast will grow when he has an imbalance between progesterone and testosterone and estrogen. When these balances are out of whack, a man breast does not know the difference between him being a woman or not. It's the same because it's just all these hormones. And so, first of all, polycystic ovarian syndrome, which is related to an insulin resistance. Okay, so a lot of times they'll put you on something that is something that would basically lower your insulin or be something like a pre-diabetes. When you have someone that has PCOS, they put them on those drugs. Now, what we fix the fat metabolism, which is or the insulin resistance is for her, she noticed a huge benefit from going on the keto diet. She reduced the carbs, and in fact, for a while, she went even carb-free. I do not recommend a person do a carb-free for life, okay? You do it for a while because you absolutely need carbohydrates. You need glucose, okay? But for a while, what you do is if you take the glucose away, your body will eat up your tissues, especially the unwanted tissues first, to get the glucose it needs. So it will reduce deposition. Plus, what it does is it trains your insulin response to work better. It's like sending your lazy gamer kid who's very sassy and won't do anything, right? And just ends up just leaving a mess all over the house. You put him on a bus and you send him out to military camp, and he goes out and he works out in the woods, and he comes back and is, yes, sir, no, ma'am, and he does it the first time. And I'm not saying turn him into a robot. It's just sometimes behavior and correct behavior. That's what insulin response is when sugar comes in, and if it's more than you can burn up right now, the insulin sure better go in there to make it come out of the cells, because too much sugar in the cells feeds bacteria and viruses and feeds the things you don't want. And so if you're not going to use it, then don't let it sitting around, okay? So part of her issue is that she had a bunch of these things kind of going on. So also for the insulin resistance, we had her on NAC, which is N-acetylcysteine. We had her on green tea, the polyphenols that are in green tea, and she also needed to lose some weight, okay? Um, but her big thing was I really want to get out of the woods of this. I want to not have to be waiting, for the other shoe to drop for me to get breast cancer, for me to get this thing. I need some peace of mind, because if you're just waiting for the car to hit you, man, you can't relax. And then also magnesium. She was, we see a lot of deficiency in all Americans in magnesium and zinc and a number of these other trace minerals. I'm going to get later into what do we do? These things, these basic things are so essential and so important, which is how do I breathe a sigh of relief and don't be afraid of the world out there, because I was given a body that was meant to deal with this. And if I wasn't given a body, can I develop a body? That little weakling that can be turned into, was that Jack LaLanne, whatever. Don't let him kick sand in your face. You can be strong, because he was, and he did, and he became very strong, But he, again, just because you were born with something doesn't mean that you have to be stuck with that. Just because you were born with something and then you lost it doesn't mean that you can't get something back. I'm going to get later into some super awesome real studies about, we thought that you could not develop innate, which is the innate is the one that you were born with, which is, that's it. You don't get no more, you get what you got. And then we thought that was unchangeable. There's some studies that show some simple things that anyone can do right now. You don't need to buy it from me. It doesn't cost anything. They're free. This is amazing. It had huge difference in terms of developing an immune system, developing the things that are the markers for an immune system. And they proved it because after they did this practice, they then injected them with something like in E. coli, basically like they stuck them with a poop stick, and that will show if they got infected. And the ones that did this, because again, just getting infected with something doesn't mean you're going to get it or you're going to get it that bad. It's all about developing the immunity, developing the immunoglobulins, developing the response, the antibodies. They built the antibodies, and the ones that did these practices, and I'm going to tell you at the end of the show, that you can do for free. They 100% of all of these, and the ones that were the control group, they didn't have the same effect. And what happened is there was a noticeable difference, and they developed the antibodies when they were given something to make them sick, right? So the body said, okay, you gave it to me. Here's what I do about it, and we fixed it. Okay, so let me see. All right, yeah, let me move on to this. Okay, yeah, and so the case was, okay, she was able to get through this thing, and after a number of months of working with her, in fact, I even think we worked with her for about a year or so, she was able to go back even to her doctor, and some of these markers that were found in her blood and things like that, they came down to normal levels. And so now the doctors were basically said, you know what, we don't really need to keep watching this. Like, you can go home and, plus her body changed. She now knew how to handle fat. She now was able to maintain her weight much, much better. Now her insulin response was much, much better, so she doesn't have to worry also about pre-diabetes and all these other things. She came through on the other side, and now she also understands how her body works, especially with eating. What should she eat? And it's not always this what she learned, what like I've learned, and if you're correctly, you don't want to have the same diet every year and all times of the year. You want to find out, what is my summer eating? What is my winter eating? What do I snack on? When are the times that I fast? When should I eat? When should I not eat? And this changes, and you should be able to adapt to it so that you can, just like a surfer, man. You don't, you don't do every wave the same way. Each wave is different, and you have to take it for what it is. And really good surfers are able to say, "Oh, I can do this for this little wave, but this big wave, this they change their boards, they do it's and they're able to surf it." That's what we're talking about. Immunity is getting your body to actually take this force, and instead of being crushed by it, develop a strength with it and then ride it and actually move you in a direction of positivity. That's the whole idea of innate healing ability, and we have this innate healing ability. Okay, this is Jason Eagle, your natural health authority. We're going to get into this next one. As a man who had neck injury, acute neck injury, he was in a car accident. He had a whiplash. He had an injury way years before. I think it was a football injury when he was like in his, in his teens. And his neck always kind of hurt a little bit, right? And so he had already developed some scar tissue in his neck, right? But then this whole, I think he was in his 40s, might even been in his 50s actually, when he had the car accident. And the car accident basically just totally, he couldn't move his neck, and it was bad. And when you get a really bad neck, you immediately think, oh my goodness, I'm going to have neck surgery. Okay, well, he came to me, and what we found is no, you don't have to have neck surgery, right? And so it was me working with him, plus I also sent him to a chiropractor, and I worked back and forth with the chiropractor, and this guy was in the middle and using both of us, and I helped to direct him to do this, to do this. So the very first thing that you do with an acute, let's say, back injury, including, let's say, your low back. So let's say you slip a disc or something like that. And if you've ever slipped a disc, you'll know that it's horrible. It hurts to breathe and stuff like that. Even if, let's say, you pop a rib out, that really hurts to breathe. The first thing that you take is what's called Ligaplex. This comes from a company called Standard Process. And when you look at the ingredients of Standard Process, you go, how could that do that? That doesn't even make sense, because this is just whole food nutrition. They are for these farms out in organic, beyond organic farms out in Wisconsin. All of the products are grown here in America. Plus, they have animals and things like that. And so everything is taken in its most clean, raw state, and it's just compressed, and it's just a bunch of vegetables and grasses and seeds and nuts and herbs and then animal glandulars and stuff like that. And we'll get into talking about that later, because it's information for the cells. Okay, so if you have a chronic back problem or neck injury, you do Ligaplex 1. If it's, acute, meaning it just happened and it's an acute trauma. If it is what you would call chronic trauma, then we move to what's called the Ligaplex 2. Okay, because he had chronic, meaning he had a neck injury from way in the past, I also tested him for the mud packs, and he had to have a bunch of mud packs. So we had to do the mud packs on his neck, which is essentially your neck, what holds your vertebrae up, especially when you're born and when you're young and healthy, is it's a magnetic field. It's like magnets where they levitate on top of each other. They are attracted but detracted at the same time, and it's like a magnet that, like a maglev train. That's what your vertebrae are when you're healthy. Well, sometimes you can blow these electromagnetic fields, and the mud packs helps to restore them and remagnetize them to the best. That's the best way I can describe it. But some of the problems is it was stuck, and so it had to be moved. And so sending him to a chiropractor to work on his neck and his whole back and everything like that, and especially with his neck, when he first had the injury, the chiropractor would work on it, and then I recommended that you put ice on it afterwards. Again, you hurt your neck, especially if it's a disc, do ice. Put ice on that low back, because if that reduces the pain, so this gets into the rule of thumb. Should I do heat or should I do ice? Okay? If it's hot, red, and swelly and pain, that's ice. That's always ice. And if it's a disc, meaning right at the center of your back, not in the muscles off to the side. So let's say in your low back, if it's right on the bones, then that's where you put ice, because that's the disc that is you want to shrink. But if it is, you put heat on it, is if it's a muscle. So if it's a muscle that's tight, if it's muscle tension, it's like hard taffy. And so you want to suck on that taffy. You want to warm that taffy up. So that's what heat works for. So the rule of thumb is use ice for if it's acute, and you use heat for if it's chronic. Okay? Then the other thing that we had to do is we put them on what's called the phytozymes. The phytozymes are these what's called enzymes. They are a proteolytic enzymes, meaning it digests protein. And when you take them 3 times a day on an empty stomach, what it does is it eats away naturally. It eats away at this scar tissue that you don't need anymore anyways. And in fact, when you're trying to move, let's say chiropractically and stuff like that, you can only move as far as the webbing of the scar tissue lets you move. And so over time, if you're doing some physical therapy type of stuff, you want to have something in your body, especially if this is old, you want to have something to dissolve the scar tissue. Okay, so the phytozymes does that really, really well. Here's the other thing with his neck. This is another thing that no one would have found, okay? And I'm not patting myself on the back, but I am. Is if you understand how the neck works, if you look at a person that has a big belly, a man that has, like, say, for instance, a beer belly, that hangs out his body. And what that does is you have to balance your head in order to keep you from tipping over, like the weeble wobbles. And so when you have this excess weight at the belly, what happens is you're never going to get a neck right. Your neck is going to be all squished down. So we had to also fix his belly. Well, what we found with him is he had a lot of candida. He had a lot of, because the sugar that he was eating, is he had a lot of candida overgrowth, and so he was bloating. His whole guts were bloated. You see these guys, their guts all like a, and it's not like squishy jelly. It's hard. That's a guy who has a lot of candida overgrowth. Again, something's expanding in there, like a big balloon. Okay, so for that, we increased his hydrochloric acid, meaning we made sure that when he ate food, especially cooked food, but for him, any food, he finished it up with taking some hydrochloric acid, that's what your stomach produces. And if the hydrochloric acid is too low, then you don't kill everything off before it goes into your small intestine and large intestine. And so these things will start to grow. So we also put him on allocidin, which is garlic, with these pills, which he was essentially taking 24, so it's 24 capsules a day, which is kind of a lot, but that would be the equivalent of, like, say, 8 to 10 whole bulbs of garlic, meaning there's no way you could eat that much garlic. But in this pill form, in this concentrated form, in this natural form, what it does is it gets into the guts, and then it starts to kill off the bad guys, so now we can get to what's called the probiotics. There's the the things that are bad for us, and then there are the things that are good for us, okay? Then the other thing that he had going on, sounds like this guy's got a lot, is he also had acid reflux, okay? And so part of his neck was because the way he was sleeping. And so what I told him is, if you have acid reflux, especially with a gut like this and a neck problem or a back problem, try and lay on your left side, okay? Again, you'll find with the men that have, like, the chronic snoring, lay them on their left side. And sometimes what you do is get one of those body pillows, or basically, stack pillows around your body so you're held in that side lying position, and you lay on your left side, because the way that your stomach curves is if you lay on your back, stuff will gurgle up, kind of like that S trap that's in your sink, or your toilet. It keeps it from bubbling up. So when you lay on your right side, that's the bottom of it, and stuff just spills right up into your throat, right? If the muscles are not tight enough. Laying on your back, it's still also, but if you lay on your left side, it's downhill. The slope of your curvature of your stomach, or the pyloric sphincter, it curves as this S curve, and so stuff is going to have it's going to be harder for stuff to bubble up into the esophagus. So for him, this is all these things that he did actually healed his neck, and healed what was actually acute and chronic. And so now he's got a great neck. He still goes to see the chiropractor every once in a while. It became part of his practice, but he doesn't need it the same way that it needed before. And he really feels a lot better. Pretty soon here, usually it's at right around 1:30, we get the call from Dr. Sivakumar. So I'm going to move on to this next case, which is this was a man who had to be on lots of antibiotics. He was sick for a long. He was in and out of the hospital multiple times. I think he had sepsis and stuff like that, which is he had infection throughout his whole body, and he had been on years worth of antibiotics. And so he got thrush a lot. Thrush is like little babies get that, which is their mouth. They get that white coating all over their tongue, and then it gets all red on the inside. Well, that's what was happening to him, and that's a super dysbiosis, or a super yeast overgrowth, meaning when your immune system is totally destroyed, yeast take over. And he was in a lot of pain, and because it was through his whole guts and everything like that. So what we did is a lot of people would put people on probiotics, but he needed to be on a whole bunch of probiotics, and there's different types of probiotics. So we took one form of the probiotics, which is it has a special what's called enteric coating, which is when you swallow it, it's able to survive the stomach, and it opens up into the large intestine way down low. So it's kind of like a time bomb, and it opens up right where you want to get it. So if you swallow them whole, if you chew them, then it will repopulate the upper microbiome. Okay, this is what's called the microbiome. Then we also put them on what's a product called Microbiome 18, which is 18 specific types of probiotics, plus a very specific one called soil probiotics, which is when you were a little kid, you were getting dirt in your mouth and stuff like that. That actually made little kids healthy. It actually helped them. And when people's whole guts are destroyed, he's not going to go outside and play in the dirt anymore. So should you eat some dirt? Yes, actually you should. That's what gardening is so important, Gardening out in your good soil, that you fix the soil, not only makes good vegetables, but it restores your microbiome, sticking your hands in the dirt. But when you have a person that has had a antibiotics basically ruin their system, they have to be very, very careful. This is the guy that had to wear the mask even before we were wearing masks, okay? Then we also put him on what's called xylitol. Xylitol is they make gum out of it, and they make toothpaste, because xylitol is one of these 8 healing sugars that kills these bacteria, especially the ones that cause the dental infection. But what you can do, so I recommended that he get the toothpaste with that. You can get these little candies called ice chips. I also recommended he go to the health food store, and you can buy it in bags and use it in place of sugar. So you cook with it. And what it will do is the more amount of the xylitol is what's called a prebiotic. It is food for the probiotics. Then I also put them on what's called galactin. Rabinogalactin is another prebiotic, it is basically soil for the probiotics. Then we put them on what's called Dentaven. This is all of the all of the probiotics they have. Dentaven is these one capsules that you open up, and then you put them in your mouth, and you kind of hold them in your mouth for a couple minutes. And what it does is it rebuilds you have glands in your face. You have glands in your cheeks called the parotid glands. And the salivary glands and the submandibular glands. So the salivary glands produce saliva and enzymes, but they also produce probiotics, because when you chew, the first stage of digestion is your body squirts these juices into the food, and it adds your own probiotics so that you can then start to brew this stuff before it gets into your stomach, so that you can then extract all of the nutrients out of the food, but also heal your gut. Well, his whole system was destroyed. So we had to go through all parts of his body and rebuild it. One of the other things that I recommended is for him is these enemas, because taking probiotics through the mouth, whether it be sauerkraut or yogurt, all these other things, because he was also getting thrush at the anus, meaning it wasn't just his mouth, it was the whole alimentary canal. And so so if you're going to swallow it, most of the time it's not going to get there. Okay, but you can actually put it there, which is a probiotic enema. A really good one is you actually get some kefir, which is you can go to Whole Foods and you buy like Lifeway. You get the unsweetened, just the raw kefir, right? The unsweetened one. And what you do is you put it on mix it with a little bit, so probably about like 2 ounces of it, and mix it with another 2 ounces of water and let it sit on the counter for about an hour or so, just to kind of come to room temperature. And then you mix that in about 2 quarts of water. Okay, so you dilute it into water. And then you take that as an enema, which is you're putting it up into the rectum, you're letting it stay there for hopefully like about 5 minutes, and then you expel it, and then you hold it again for what's called retention enemas. And the probiotics will actually start to repopulate your lower gut. I also recommending doing sauerkraut, which is you can get the Bubby's sauerkraut, or this is not the sauerkraut that has vinegar. This is raw sauerkraut. And what you do is you do the same thing, which is you cut it, you add maybe about like 2 ounces of sauerkraut juice into some water, and then you add that water. So only about 2 ounces of sauerkraut water or sauerkraut juice is added to the whole 2 quarts of enema. And that's got some salt in it, but it's got probiotics. So you want the natural sauerkraut, okay? Another thing that you can do to help to clean out the infection, because again, irritation is coming from infection and a dysbiosis. He had still bad things growing inside him even after he went on so many antibiotics. So the whole point is the antibiotics is like napalm; it kills everybody. But sometimes the bad guys are the first guys back in the jungle, and so they never go away. So if you bring probiotics in, see, probiotics are very weak, and so they need to be protected. So also doing what's called a marine enema, which is you basically sea salt, put it in a glass bowl. You can contact my website and I've got the recipe for it. But basically, it's as good like a Mediterranean sea salt or the pink salt, and you put it in some water, like 2 quarts of water. You then put it out in the sunshine, and you let it sit on the grass or outside. Don't worry about bugs or anything, because salt kills everything, and as well as you're gonna strain anything that's in there. The reason is because you're letting the sun hit that, and what it does is it stores energy in the salt crystals. It's called piezoelectric, because I like to say this, it's like putting sun where the sun don't shine. You've ever heard that? What the marine enema does is, because the salt will actually sanitize. So when they say, like if you got, let's say, a tooth infection, you gargle or you swish, or let's say a throat infection, gargle with salt water, because the salt water will kill some of the bad guys, but will also help to stimulate the good guys. So for him, a marine enema, there's 3 different types of enemas that he used to help to repopulate, to sanitize and rebuild the lower end, which is almost impossible to do if you're taking it through the mouth. It's just nothing really all the way there. It's hard. So we were coming at it from both ends. And what happened is he rebuilt his system. And so now he's at the point where he's able to live more normally. Say that again? We got the caller here? Oh, very good. So here we go. We got my caller here. This is Dr. Sivakumar. Hello, Dr. Sivakumar. Are you there?
Hi, Jason. Yeah.
Hey there.
Good afternoon.
Good afternoon to you. So today we really wanted to, and this was your idea, but I'll go with it and we'll follow with that, which is we hear a lot about what's called antibodies and antibody testing and antigens. These things are thrown all over the place. Again, I like to say that you are the horse's mouth. So from the horse's mouth, from the actual doctor, can you tell us what this means? Let's start with that. What are antibodies?
So, Jason, so we are almost a few months since December. We've been dealing with this virus now, and the more we are dealing with this virus, the more we are learning, both as a scientist, as a clinician, and I'm not a scientist, I'm a clinician, but from the scientist standpoint, clinicians, epidemiologists, and we are all still learning more about this virus. So a lot of these conversations, what we have today, things may change later because the more data we get, and the more knowledge we are acquiring from doing the studies, and we are learning more, okay? So we may come back to this topic in the future, and we may have to revisit some of these conversations. But in general,
and I'll speak on that too for a second, which is there's this Moderna study that from Cambridge, Massachusetts, and I went through it and read it, and again, that's exactly what they're saying, which is we are not sure if natural infection confers the immunity. We think it does, but we're not sure. And we're also not sure if the vaccination confers immunity. We don't know yet. And so it's still kind of up in the air, but like that's what we're learning. So again, what is an antibody?
So, Jason, let's talk a little bit more about the virus itself for a few seconds, so the listeners can understand. So this virus is a RNA virus. R is in Roy, N is in Nancy, A is in Adam, RNA virus. There are other kind of viruses as well. They are called DNA viruses. So this RNA virus is a single-stranded RNA virus, and it has a very specific surface. They look like spike, and they are called spike protein, S-P-I-K-E, spike protein. So when this virus enter inside your body will recognize the virus has entered in through a small protein called ACE, angiotensin converting enzyme number 2 receptor. That's how your body recognizes that. And there is a whole bunch of that in your lungs. That's why your lungs get affected. As soon as this virus enters inside your body, your immune system, which is a combination of T cell and B cell, and others, macrophages, all kinds of cells in your body will recognize this virus and try to kill this virus. So
right, like different types of troops that have different, like different types of troops where this guy used this particular weapon and this guy has this particular outfit on. They all have different roles in what they do.
Correct. So they are, to make it simple, they are like soldiers inside your own body. Yes. And as soon as they recognize this virus, now the body goes through a cascade of reaction called immunological response. And during this process, your body comes up with a protein called immunoglobulin. There are two kinds of immunoglobulin. One is something that your body will produce immediately. They are called IG, means immunoglobulin, M, and then IgG. So the M stands for immediate, and G stands for long term. So what we have found in other diseases, as soon as you finish fighting this disease, if you have plenty of IgM, that means you fought the disease well and the disease was in your system recently. And if we measure IgG, which would be a response which you will see a little bit down the road, and once you have that, now you have a pretty significant immune response, and your body is protected against this virus. So a lot of manufacturers are trying to figure out how to make this, vaccine to simulate, what has happened when your body goes through an infection.
Yes.
So
again, then that kind of gets into a little bit in terms of, so where did these things come from? So we're talking about it comes from in our body, or it can come from outside our body. So let's go into that.
Right. So if your body is strong enough immunologically and it has created its own antibodies, now in the future, when you come across this virus, now the body remembers and it produces antibodies and attack the virus and eliminate
before it gets too far at all. Right.
Right. So
and that would
your
be
own immune system.
That would be the immunity that is conferred from natural infection.
Correct. So dating back to 1796, the vaccine has been around, and there are many, many variations to these vaccines. But the vaccine, what is very specific for coronavirus, since January, when the Chinese government released the genetic sequence of this coronavirus, now we know what type of vaccine to develop. So the vaccine we are focusing on is called messenger RNA vaccine. It's a pretty novel vaccine, so that's why there is plenty of research being, focused on this vaccine. And there are many, many companies throughout the world are looking to develop this vaccine. So, Jason, when you look at the vaccines, there are 3 phases to this vaccine. One is the phase 1, where we look at safety of the vaccine. Usually it is being administered to about 20 to 80 people. And then phase 2 is called the efficiency of the vaccine. We give them in about 100 or 200 people. And the phase 3 is called an expansion phase, where you give to thousands of people. And so typically this can range anywhere from years.
So that's why they said it's probably going to be a year to 18 months, even from now, before we even consider. And we're still learning about what's even happening before we get there. So
I think people like Dr. Fauci and Dr. Briggs, they're all on every day updating us. So we should listen to the experts who are on the front line, who actually is learning more directly from the manufacturers. So we should probably get more updates from them, as well as from the scientist community through a lot of research papers.
Yes. Go ahead.
So the safety of this vaccine is always a big concern, right? So that's what they are studying right now. And so the first phase is already in. And now we have to go to the second phase, which is the efficiency phase. And I think the FDA will look at all this very closely for every one of these phases to ensure that the disease is not getting enhanced. So this is an important part of these vaccines. When you give the vaccine, you don't end up with more disease. That is called a disease-enhancing property, and you don't want that.
Right. And again, there have been some that have done that. And it's not the vaccine, it's the people. It's each person's immune system, how they develop to it. And some may develop, and so they're trying to develop where they're trying to get it where the most are going to get the best type of response from it, as opposed to you're going to still have some on, that will eke through, that will have some negative, but we're trying to find the best one. But again, my question then goes into, and we still don't know this yet, but it's still a valid question, which is, if we develop our own, do we still need to get the vaccine when it becomes available in 1+ years, like a year and a half right now? So if we say, for instance, do some antibody testing and find that we've developed these, especially the immunoglobulins and all of the different markers, would that kind of confer and say, I guess it's almost as if you've been vaccinated yourself? What do you think?
Correct. So I think I don't know the answer yet, but maybe in the next time when we get together, maybe we will have a little bit more data. And because see, the immune system response is a range. It can be mild to moderate to severe, so that your immunoglobulin levels may reflect off of that.
Right.
So people who have been infected with the virus, they still have not developed an immunological response. So we've done immunoglobulin testing on them. Some of them came back negative, to the surprise. So, so we will wait before we conclude.
And we haven't had enough time to say, if we found the people that had natural immunity, we don't know, because we haven't had a second round of this yet to say, because the real question is are those the people that are going to be protected from a second round of it? There's some good evidence that say there's a lot of them that are, but they still don't know yet. So that's why all of this is still kind of, like you said, you're absolutely right, which is we just have to be constantly just questioning and staying on top of it, because we're all learning new about this, and we're also learning more about our bodies. And the other thing that that's why later we'll talk about things like zinc and stuff like that, is are there things that you can do to help your body, for instance, say, develop that immunity, so the people that have the right minerals in their body, we know that they're actually that's one of the factors, which is, or less stress or something like that, you give yourself a better chance of developing of having the correct response. Is that correct?
Yes, and anything that comes in the future, the present situation is we got to protect ourselves and protect our loved ones as well as our community members. So social distancing, wearing the mask, washing the hands, not touching the face, and keeping the frequent contact surfaces clean. These are all very basic, important, things that we should continue to do, so that
and then it brings up the question, which is like, okay, because see, we've always had a flu, and the flu, many years takes out 30 to 40,000 people. But see, we were never really doing these practices. So this is going to affect this thing that we're dealing with, but this is also in the future going to affect even those, because 30 to 40,000 people is a lot of people that we've just kind of lived with every single year. Oh, that's just normal. So those particular cases of just normal flu will also be helped and reduced by these measures that we adopt, just in kind of find out, well, what's the new normal? And, can it work in our society?
The heightened alertness of coronavirus will also help manage other diseases quite well, because as soon as someone has fever, cough, we are going to be more, vigilant about it, try to help them early on.
Right.
So
and hopefully we can go ahead. Sorry.
The time will say probably this year, winter, next year, so we can learn more about the flu virus impact as well. Yeah.
Well, and I think the other important thing too, one of the messages that is important right now is that there was a time early in this where it was probably prudent for people to stay basically out of the system, stay away from the hospital unless it was absolutely, necessary. Well, now we know a lot bit better, and so now it's the point where I'm encouraging people, and people should be encouraged to just go to the doctors. First of all, what we've also learned too is the new practice of basically calling the doctor, and the doctor, your general doctor, and over the phone or over Skype or something like that, before they actually have contact, to determine should you come in and should this. So this new development has actually probably helped the whole medical system a lot too, to kind of say, yes, come in, don't come in. But we're now at the phase where people really should be encouraged to basically reestablish contact in terms of staying on top of it and treating these things that they normally would have been like, I'll just, I'll take care of it myself, or I'll just ignore it, or, because if it is something that is along these lines, the sooner that you treat it and identify it, the way better. So this is, hopefully we're moving into a phase now where people are kind of going, it's better to know. It's better to know than not know.
Thank you, Jason. We will touch base again next time.
That sounds great. Okay. All right. Thanks a lot, Dr. Sivakumar. We're really learning a lot, and thank you for doing this for all of our listeners. And again, these things get recorded on my Facebook and YouTube, and they're going to be out there and reviewed for forever. So people are going to remember you as one that was out there. And I like the way that you talk. I like what you're saying, which is basically, really good, logical, and honest. And again, also prepared to say, we still don't know and we're still learning, but we will learn and we are learning. And that's really encouraging for people to know. Thank you so much.
Thank you, Jason.
Okay. All right. All right, everybody. That's, again, it's great to hear right from the horse's mouth. And in the last few, I was going to do a whole bunch more. So next week, I'm actually going to go into this, which is we get into Are there some things that can help to develop immunity? Now, he brought up something in terms of these immunoglobulins, right? So the story of how you develop this immune system, I'm going to get that into, well, let me start with that. Let's start with that, okay? So this immune system that we have, which is how do we get an immune system? And even as you're older, well, the very first immune system you get is you're a baby and you're born, okay? But when you are inside the mother's womb, you're in this amniotic fluid, this salt water type of thing, and it's sterile. You have your what's called innate immune system. That's what's built with you. Basically, you're given your inheritance. But then you've never faced the world. You've never come in contact with the world. So your body, it's all foreign to you. So the very first immune system that comes to a human being is going through the birth canal. This mucus that is on the walls gets, so when a baby comes out from a vaginal birth, they have to wipe them all off. Well, that's one of the first hits that a lot of us take, because a cesarean section, with a C-section, the baby is pulled out of the stomach and never goes through the birth canal, and so they never get this immune system, this very first hit, because it goes into the baby's nose, it's all over their skin, everything like that. And there has been some real big studies on, for instance, in undeveloped immune system, kids that have a traditional cesarean section have a reduced immune system, as well as there's higher levels of autism. That is because the immune system, the gut brain, is related to that. So that's in America. We have there's a lot of cesarean sections. There's a lot of C-sections all over the world. But over in Europe, in Italy, they've actually done some studies of where what they did is, if you knew that you were going to have a C-section, what they did with the mother is they took a sterile gauze and they inserted it into the vagina, into the vaginal canal, to soak up some of these mucus for about an hour before they deliver the baby. They deliver the baby out C-section, and then what they do is they swab the baby and they put it on their skin, they put it in their nose, they put it in their mouth, they put it in their ears. And what they're doing is inoculating, and it's better than nothing. And what they found is many cases is the children are actually getting better immune systems and have lower incidences of autism, things like that. So the very first thing is we get the mucus. The second thing is when you get breastfed, the very first milk that you're given is what's called colostrum. And inside human breast milk, there is what's called endocannabinoids. And the endocannabinoids is part of how our gut works. This is part of your immune system. So colostrum is a stand-in immune system. Let me fast forward to, we can take colostrum. I'm going to talk especially next week on, you can do your homework. You can do, until next week, do your homework on this one. Google what's called the effects of bovine immunoglobulins in immune function. Meaning, if we take these dried, basically, bovine colostrum, they take these healthy cows and they take that colostrum milk and they dehydrate it and turn it into a powder. That powder then you can take as a capsule, or you can put it in foods or make a smoothie out of it. It provides all of the immunoglobulins, and these are what's called human active, meaning it's the same type as what you would get from your mother. IgA, IgG, which Dr. Sivakumar was talking about, IgM, IgE, IgD. These are these different forms of it. Well, the colostrum provides all different types of this. So literally it is, remember he said, is when you develop immunity, you develop, for instance, these immunoglobulins. So if you actually take them inside, there's a great study here that I referred you to where they did study, and they're suggesting this is probably the thing that we should be giving to people who are elderly, who are at the highest risk. This is for children. This is for anybody, meaning it's an immune, so you can ingest these immunoglobulins and they go into your system and it's as if your body made them. So that's a real leg up on terms of developing immunity. Now then, so that all goes towards the colostrum, and all this other stuff goes toward what's called developed immunity or acquired immunity. Now the next part of acquired immunity is as the baby is touching things and touching the floor and all this other stuff, they're coming in contact with these things that are these foreign things that go into their body, and maybe they get a little sick from it, or maybe they don't. But what happens is their body starts to build up information, data, okay? That's why they've actually shown children, let's say the rich kids that live in these very clean houses that are completely sterilized, they hand sanitized all the time, they're going to have a higher risk of some of these illnesses, whereas the poor kids, especially the studies show that the kids that are raised with, little babies that are raised with dogs, when they're crawling around the floor. Yes, it's dirty. But what happens is it's going into their mouth, and they develop a much stronger immune system as well as intelligence. So this is the end of my show, and we're going to finish up again next week on this whole thing about immunity. So this is Jason Eagle, your natural health authority, and until next week, bye-bye.
You've been listening to Ask the Experts with Jason Eagle of Strategic Healing. Jason will help you live a pain-free, high-energy, healthier life naturally. As a certified practitioner in multiple healing modalities, Jason creates a finely tuned and highly personalized program just for you that will get you back to living your best life. Get started today by calling 734-985-5891 to make your appointment, or go online to strategichealing.us. Strategic Healing is located at 2545 North Opdyke Road, Suite 106A in Auburn Hills. Ask the Experts with Jason Eagle of Strategic Healing can be heard every Wednesday at 1 p.m. right here on WRDT, the Word Station.